Welcome back guys. Now let's discuss about the topic of sleep. Now sleep is mainly divided into how many phases? Okay, sleep is mainly divided into two phases, NREM sleep and REM sleep. So what is this REM? Rapid eye movement. Okay, so in the sleep eyes will move. There is this one phase of sleep where eyes will start to move. This is called as rapid eye movement phase or REM sleep. And there is one more sleep where there is no rapid eye movement. No rapid eye movement. So tell me, sleep is divided into how many phases? Sleep is mainly divided into two phases, NREM as well as REM. Now just look at this image where I am showing. See the person is falling asleep. Okay, now the person is beginning to sleep. So the person first goes into NREM or REM? Definitely the person goes into NREM. Okay, first there is no rapid eye movement. First the person will go into NREM. So NREM is divided into how many phases? See, NREM stage 1, stage 2, stage 3 and stage 4. So the person is going into first stage 1, stage 2, stage 3, stage 4 of NREM. So from this we can clearly say the NREM is divided into 1, 2, 3, 4. 4 stages. Okay, first NREM. After that the patient is coming, see the person is coming into REM sleep. So the person will be having NREM sleep, later the person will be having REM. Again the person will go into NREM, again he will come back into REM. So one NREM and one REM is called as one sleep cycle. So in one sleep cycle there is one NREM and one REM. Okay, now let's first begin our topic with the NREM sleep. Okay, first let's begin the topic with NREM sleep stages. Now we have already discussed the NREM is divided into stage 1, stage 2, stage 3 and stage 4. 1, 2, 3 and 4. Okay, so in NREM stage 1, which waves are seen? See, NREM stage 1 is definitely a light sleep. Okay, definitely a light sleep. In light sleep, which waves are produced? Theta waves are produced. So theta waves are produced during drowsiness. Okay, theta waves are produced during drowsiness. And what is the frequency of the theta waves? 4 to 7 hertz. So that's why see 4 to 7 hertz. Theta waves are coming. Okay, it's a theta waves. Theta waves are coming during the NREM stage 1. Now after NREM stage 1, what do we have? NREM stage 2. Okay, NREM stage 2. In NREM stage 2, which waves are coming? See, the person is going little deep into the sleep. Okay, he is going little deep into the sleep. Now in NREM stage 2, the frequency of the waves which are coming are 8 to 12 hertz. Okay, the frequency is 8 to 12 hertz. Now you will get it out. Sir, 8 to 12 hertz is the frequency of alpha waves, right? Yes. Even alpha wave frequency is 8 to 12 hertz. But can I say alpha waves are coming here in NREM stage 2? No. Alpha waves are not coming in NREM stage 2. Why? Because alpha waves are awake waves. Alpha waves means the person is not sleeping, just the person is closing his eyes. So alpha waves are seen during awakeness, not during sleeping. So these waves are also having a frequency of 8 to 12 hertz, but these are not alpha waves. Why? Because in these waves, you can see certain important points. Okay, please concentrate here. This is stage 4. Okay, stage 1 NREM. Stage 1 NREM. See, in stage 1 NREM, yes, we have discussed. In stage 1 NREM, there are these theta waves present. Okay, stage 1, theta waves are present. 4 to 7 hertz waves are coming. Now, in stage 2, this is the 8 to 12 hertz. Okay, the frequency is 8 to 12 hertz. But these are not the alpha waves. Okay, these are some other waves. Okay, the frequency is same. But here you can appreciate these are the sleep spindles. Okay, sleep spindles. You can see in stage 2 NREM, you can have sleep spindles as well as a K complexes. Okay, sleep spindles, like all the waves are coming together, they are merging together. Now the sleep spindle and the K complexes are seen. Okay, these are not the alpha waves. Frequency is 8 to 12 hertz only. Okay. No, sir. Now NREM stage 3 and NREM stage 4. Now NREM stage 3 and NREM stage 4 are the deep sleep. Okay, they are the deep sleep. So which waves are seen? Delta waves are seen. Okay, now what is the frequency of delta wave? The frequency of the delta wave is 1 to 3 hertz. 1 to 3 hertz. So in NREM stage 3 and 4, you will be having delta waves or slow waves with the frequency of 1 to 3 hertz. Okay, if someone gives you this kind of image, and here what you are saying, there is a sleep spindle and there is a K complex. Okay, the waves are wide and away. Now there is a sleep spindle and K complex. Now whenever you see sleep spindles and K complexes, they are seen in NREM stage 2. NREM stage 2. Okay. Now after this, let's talk about the REM sleep. Okay, now let's talk about the REM sleep. See, REM sleep means rapid eye movement. Rapid eye movement. Now you can ask me why there is rapid eye movement in REM sleep. Why? Because see, try to understand. Now whenever usually see here. Now if the object is moving like this. Okay, if the object is moving like this, what happens? Now the light waves are going to enter into my eyes. Now this information about the movement, this vision information is going to my occipital cortex. Okay, so automatically when object is moving means automatically our eyes will try to focus on that object, so automatically eyes will move. So my point here is, when object is moving, automatically your eyes will start to focus on that particular, okay, latch onto that particular object and your eyes will start to move. So during sleep what happens is, there is electrical activity in your occipital cortex. The magnocellular pathway is activated. Okay, during REM sleep, actually there will be electrical activity in the pons. From there the electrical activity will be going into the lateral geniculate body, and from the lateral geniculate body the magnocellular pathway is activated. Now usually we have studied the magnocellular pathway contains the information about the movements. Magnocellular pathway carries the information about the movements. Now what is happening during night? During REM sleep, magnocellular pathway is activated, which means now your occipital cortex is receiving the information that something is moving. Okay, actually your eyes are closed, but electrical activity is going. That it's saying to your occipital cortex that something is moving. So automatically what your eyes will do, your eyes will try to focus on it, your eyes will start to move. So why there is this REM sleep, why there is this rapid eye movement in the REM sleep? The rapid eye movement is because of the electrical activity in the pons, lateral geniculate body and occipital cortex. So that's why you will see the PGO spikes. PGO spikes means ponto-geniculo-occipital spikes, which are nothing but the electrical activity in these areas. Okay, so occipital cortex is getting activated. When occipital cortex activates, even though you are closing your eyes, the vision is forming over there. Vision is forming over there. Now because of that vision, your eyes will start to move. Okay, so what is the frequency of REM sleep? The frequency of REM sleep, the frequency of waves that are coming in the REM sleep is 13 to 30 hertz. Okay, 13 to 30 hertz. Now you will get a question. So 13 to 30 hertz is which wave? 13 to 30 hertz is beta wave. The waves are having a frequency of 30 to 30 hertz. Now beta waves are seen when? Beta waves are seen during awakeness or wakefulness. But now what is happening? 13 to 30 hertz, which is a beta wave, now coming during sleep. So beta waves are coming during sleep. Beta waves are supposed to be seen during active mind, but they are coming during sleep. This is something abnormal, right? Yes, this is abnormal. This is a paradox. So that's why the REM sleep is called as a paradoxical sleep. These waves are called as, because of the presence of these waves, it is called as a paradoxical sleep. Okay, the REM sleep is called as a paradoxical sleep. Why? Why? Because see, person is sleeping, but wakefulness waves are coming. Okay, so because of that, this REM sleep is considered as a paradoxical sleep. Okay, now after this, let's discuss about the differences between the REM sleep and NREM sleep. Okay, NREM versus REM. On this side, on one side, I am talking about the NREM. On the other side, let's discuss about the REM. Now, NREM. In NREM sleep, what happens? The person is sleeping, so the respiratory rate comes down. Okay, BP comes down, heart rate comes down. Okay, so the respiratory rate decreases, respirations become slow and deep, body temperature decreases, heart rate decreases, BP decreases. Now everything is coming down. Okay, now what is REM? See, in REM what happens is muscle relaxation. Okay, all the muscles in the body are relaxed. Okay, all the muscles in the body are relaxed except your diaphragm. If your diaphragm is relaxed, means how can respiration happen? So diaphragm is not relaxed. Okay, so in REM sleep what happens? There is muscle relaxation except diaphragm and extraocular muscles. Okay, so why extraocular muscles? Why? Because extraocular muscles are the one which causes the movement. So in REM sleep there is eye movement? No. So eye muscles are not relaxed and diaphragm is not relaxed. Other than this, all other muscles are relaxed. Even sphincters are also not relaxed. I have to add here, sphincters are also not relaxed. If sphincters are relaxed, there will be urination and defecation. So usually all the muscles are relaxed except some muscles, mainly diaphragm, extraocular muscles, sphincter muscles. Apart from this, all the other muscles are relaxed. And also in REM sleep there will be penile erection. Okay, in REM sleep there is penile erection. So these are some important points. Now let's talk about the abnormalities of the sleep. What are these abnormalities called as? These abnormalities are called as the parasomnias. Okay, so what are parasomnias? Parasomnias are the abnormalities during sleep. Now for example, during NREM sleep, there are some abnormalities like night terrors, somnambulism, sleepwalking, sleep talking, and nocturnal enuresis, bruxism. All these are the parasomnias, abnormal events during the sleep. For example, what is this night terror? Night terror is nothing but the dreams. Okay, one bad dream which you cannot remember, which you cannot recollect. Okay, you will suddenly woke up and says like, something like, I have some bad dream, but I couldn't recollect anything. I couldn't remember anything. Okay, so parasomnias are dreams which you cannot remember, night terrors. Okay, and here itself I want you to know, remember like NREM. NREM means no rapid eye movement, no, but I want you to remember it like non-remembrance. No remember. See, any event which happens during NREM, you cannot remember it. Okay, REM for rapid eye movement, okay, but remember it like REM for remembrance. So the dreams which come are the event which happens during REM, you can remember it. Okay, you can remember it. So REM sleep events, yes, remembrance is possible. Okay, dreams can be remembered. If you can remember a dream, that dream is coming in REM. Okay, if like night terrors are dreams, bad dreams which you cannot remember. And what is somnambulism? Somnambulism means sleepwalking. The person is walking and he is going to somewhere. But if you ask him tomorrow, okay, the later morning, say yesterday night you are walking somewhere, where you are going, he cannot remember anything. Okay, he simply says, I am not walking, something like that. Okay, so somnambulism is a sleepwalking which is seen during especially NREM stage 3 and 4. Okay, especially seen during NREM stage 3 and 4, especially during the deep sleep, deep NREM 3 and 4. Okay, and sleep talking, usually some people, they will wake up in the middle of the night and they start to talk. Okay, with whom they are talking, they doesn't know that thing. Okay, so sleep talking is seen in NREM phase. And bruxism is seen during MCQ. This is an MCQ. Bruxism is grinding the teeth. Okay, like in the middle of the night, okay, the person is grinding his teeth, like like this. So that bruxism is seen in stage 2 NREM, and nocturnal enuresis. Nocturnal enuresis means what? It's a bedwetting. Okay, it's bedwetting. The person is like just being in the bed. Okay, it's a bedwetting. See, all these events, walking, talking, bruxism, nocturnal enuresis, all these events, they are happening only in NREM, not in REM. Why? Because see, in REM what happens? In REM, all the muscles are relaxed. If all the muscles are relaxed, see, walking is not possible, talking is not possible, grinding the teeth, bruxism is not possible. For talking, you need to have the muscles, right? Even the tongue should contract, the pharyngeal muscle should contract, the facial muscle should contract. It's not possible. Okay, and even for bruxism, grinding the teeth, you need to have the masticatory muscles. See, all this movements are possible only in NREM because muscles are active, muscles are working. But in REM, all the muscles are relaxed. As all the muscles are relaxed, so these parasomnic events, okay, these parasomnia events are not possible in NREM. These parasomnia events are not possible in REM. Okay, REM. Now, after this, let's discuss about the hormonal changes. Okay, now here the hormonal changes. See, in NREM, growth hormone levels increases. Okay, in NREM, the growth hormone levels increases, especially during stage 3 and 4. In the deep sleep, growth hormones is going to be produced in pulsatile doses. Growth hormone is released during sleep. Okay, in which sleep? NREM sleep, that to NREM 3 and 4 in pulsatile doses. In REM sleep, okay, in REM sleep, growth hormone level actually decreases. There is a little controversy in this area, but anyway, growth hormone level increases in NREM, growth hormone level decreases in REM. Okay, and in REM, it's seen that prolactin levels are increased. Now let's talk about the dreams during sleep. So dreams are going to occur when? So dreams are going to occur both in REM as well as NREM. See, dreams are going to occur both in REM as well as NREM. In both the phases, dreams will come. But the only one point is the dreams which are coming in NREM, please make a correction here, the dreams which are coming in NREM, they are not remembered. Okay, they are not remembered. But the dreams which comes in REM, they are remembered. Okay, they are remembered. Okay, already I have explained to you. See, NREM for non-remembrance, REM for remembrance. Okay, the dreams which are coming in REM are remembered. Now, what are the type of dreams? Usually the type of dreams that will come in NREM, they are like more like conceptual day-to-day activities. Okay, normal day-to-day activities, like you will have a dream that you are going to some place, buying something, like something kind of. Okay, day-to-day regular dreams. Okay, but the dreams that will come in REM, they are of more emotional type, emotional dreams. Okay, so emotional dreams are coming in REM, normal conceptual dreams are coming in NREM. So these are some differences. Now after this, let's discuss about the regulation of sleep. Who will regulate our sleep? What are the centers which will take you into the sleep? What are the centers which will make you awake? Okay, now let's divide the centers into two parts. Okay, wakefulness centers, sleeping centers. Okay, wakefulness centers and the sleeping centers. Now, what are the wakefulness centers? If you ask me, there are 4 important wakefulness centers present. What are they? Now, these four important centers are reticular formation, okay, reticular formation, lateral hypothalamus, posterior hypothalamus, and Raphe nuclei. Okay, just one more time: reticular formation, lateral hypothalamic nucleus, posterior hypothalamic nucleus, and Raphe nuclei. All these centers, okay, all these higher centers in your brain, they are considered as the wakefulness centers. What happens in the early morning? Okay, in the early morning, they will release certain neurotransmitters which will activate your cortex, and you will wake up. Okay, you will wake up. So in that way, so reticular formation. Okay, this reticular formation is a group of nuclei which are present in the brainstem. Okay, these are a group of nuclei which are present in the brainstem. Now from this reticular formation, the neurons will be connecting all the parts of cortex. Okay, it's like a switch. Actually, this reticular formation is considered as a on and off switch. So what happens? Now this reticular formation is in connection with all the parts of the cortex, and this reticular formation, it produces a neurotransmitter which is called as norepinephrine. Okay, it produces a neurotransmitter norepinephrine. So this norepinephrine, what it will do? It will keep all the brain areas active. So reticular formation produces norepinephrine. Norepinephrine is responsible for wakefulness. It activates your cortex. You are getting awake. Okay. Now lateral hypothalamic nucleus. Now this lateral hypothalamic nucleus, already we have discussed. This lateral hypothalamic nucleus, it produces a neurotransmitter called as orexin or hypocretin. Now this orexin or hypocretin is also helping in the wakefulness. Okay, now when you are having deficiency of orexin, even in the previous videos we have discussed. Now deficiency of this orexin, it will cause narcolepsy. Okay, narcolepsy, excessive daytime sleeping. Okay, excessive daytime sleeping. And posterior hypothalamus. Now posterior hypothalamus, it releases a neurotransmitter called as histamine, and it is also a neurotransmitter of wakefulness. And Raphe nuclei, it produces serotonin. It will also activate the cortex. Okay, so Raphe nuclei, the neurotransmitter is serotonin. It activates the cortex. So in your exam, the questions will come something like this: all of the following are the neurotransmitter of wakefulness, except so serotonin, histamine, norepinephrine, orexin or hypocretin. All are the neurotransmitter of wakefulness. Now in the night, what happens? See, when the person is going to sleep, all these neurotransmitter levels decreases. In the early morning, when the person is getting awake, all these neurotransmitter levels increases. Okay, so note, all these neurotransmitter decrease during the sleep. True. Now in the same way, let's talk about the sleeping centers. What are the sleeping centers? The 3 important sleeping centers are VL-PON. That's a ventrolateral preoptic nucleus, VL-PON. So ventrolateral preoptic nucleus is a sleeping center. It will take you into the sleep. And pineal gland, by producing the melatonin. Okay, pineal gland, it produces a hormone called as melatonin. This melatonin is also very important hormone for the sleep. It will take you to the sleep. Okay, and the cholinergic neurons. Okay, the cholinergic neurons, especially present in the pons and midbrain, the cholinergic neurons, they will release the acetylcholine, and acetylcholine is a neurotransmitter of the sleep. Okay, norepinephrine is a neurotransmitter of wakefulness. Okay, so what are the sleeping centers? The sleeping center of VL-PON, ventrolateral preoptic nucleus, and the pineal gland, by producing the melatonin, it will help you to take you to the sleep, and the cholinergic neurons, which are mainly present in the midbrain and pons, they will also take you into the sleep. So these are the sleeping centers as well as the wakefulness centers. So with this, we have completed the topic of, like, the phases of sleep, NREM sleep, REM sleep, different phases, like, different waves and abnormalities. Okay, hope the video is helpful. Thank you.